Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Thursday, September 16, 2021, and thank you for joining us for Ask Dr. Arwady. This, as always, is your opportunity to get your COVID questions answered. You can put them directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. We continue to get a whole lot of questions in, and I would also just remind you, you can always go to chicago.gov/coronavirus for the one-stop, lots of frequently asked questions, lots of Chicago-specific information. But we will try to use most of the time today to answer your questions directly. I first want to say thank you to everybody who wished me a happy birthday yesterday on social media. It is newer for me to have a social media presence, and so it was interesting to see how many people took a minute to wish me a happy birthday. And that was nice because a lot of people who take the time to engage with me say things that are a little bit less nice than happy birthday. So thank you. It was a perfectly nice day. And given the fact that my mood in general over the last year and a half tends to rise and fall with how we're doing from a COVID perspective, I continue to be in a pretty good mood, all things considered. So thank you again for everybody who took a moment to wish me a happy birthday. All right, so let's start with our dashboard. As always, chi.gov/COVID- is where you go to get the updated numbers for the city of Chicago. We do update this dashboard every single weekday. We got a few questions in about exactly when and how. There are a few behind the scenes updates that kind of happen over the course of the afternoon as the epidemiologists are getting the data in, cleaning it, comparing it with the state. Like, there's actually a lot of work that goes into this every day. And someone asked, why do the numbers seem like they're different a little bit day to day? So every single day, we refresh the entire database that this is based on. And in our Chicago data portal, you can download our case counts for every single day of the COVID pandemic, from the beginning. All of the data here is downloadable so that researchers or others can do their own analyses and explore things. And what we do is say that we get a case reported late. Generally at this point, testing happens relatively quickly, and so depending on the kind of test, we're often getting test results in 1, 2, 3, 4, 5 maybe days after someone is actually diagnosed with COVID, but more often it's in the kind of 2 to 3 day range. However, say we get a late report. Somebody's computer is down, they failed to report something, and it comes in 10 days later. We don't count that person as so say they got reported today, September 16th, but they were diagnosed with COVID on September 6th. We don't report them as a September 16th case. We add them to the database as a September 6th case because in terms of how it actually behaves in the community, that person was diagnosed with COVID on the date of the 6th, and that's when it matters. So sometimes for folks who've been really watching this closely, if you look back, the number for today, we're reporting 436 is our average right now over the previous week with a little bit of lag. It's possible if you looked a week from now, you might see that the average for September 16th becomes 438, for example, 439. That's because enough later cases may have been reported. So for those of you who have been following it that closely, that is the answer to that. So let's look at the actual numbers. We are averaging, as I just said, 436 cases per day. That's down 8% from a week ago. You can see on the graph here, hopefully really turning the corner here. We're averaging 16.1 cases per 100,000. Remember, 15 per 100,000. That's approximately 400 cases a day given Chicago's population. And that does mark our move from what would be considered a high risk back to a substantial risk. So this is continuing to really look pretty good. And you can see that this surge, most recently, this Delta surge, is looking a lot like the little Alpha surge that we saw back in March and April, really different than the surges before. The hospitalizations, we actually got in a question about this too from CPS Parent at Parent CPS on Twitter, saying when do COVID hospitalizations get updated? So these actually come through a few different ways. This is Chicago residents getting hospitalized. You can also look up here under latest data and go to hospital capacity if you want to see how many people are actually in the hospital at any given point. So there's two different metrics that are reported here. And the hospital data sometimes actually will jump around a fair bit because it depends on the timing of when hospitals are reported to us, when we get data from the state. And so like today, it's showing only 15, but I expect that will probably jump up a little bit more tomorrow. So again, one day is not, we don't pay too much attention to one day. It's part of why we average it and then look at the trends over time. We are averaging 4 deaths a day. Essentially flat, and then our vaccines have ticked up again, which is nice to see. We're averaging about 4,500 vaccinations every day. The lowest that we saw was in the 3,700 range in July, and this has ticked up. We think the $100 incentive has actually been helping. As a reminder, anybody in the city of Chicago over the age of 12, 312-746-4835 or chicago.gov/@home. We will bring vaccine to your house. You can do Pfizer or you can do Johnson & Johnson. And with that, you do get the $100, and that is federal funding. There was an ask to really make sure that for people who are concerned about side effects from missing work, paying for childcare, whatever it might be, who perceive that to be a barrier. And yes, it is true that if you call for 10 family members, for example, all together, or 10 neighbors get together and you call and make an appointment and come, and it's the first time that folks are getting vaccinated, this doesn't apply for booster doses, yes, you would get $1,000 worth of gift cards as that extended family or that neighbor group. So we've seen our at-home vaccinations really pick back up again, and appointments are actually getting full again across all regions, so we may expand some of that capacity some more again. But as we're rolling out hopefully some of these additional smaller incentives, I'm very pleased to see that number continuing to increase. And on Tuesday we shared which zip codes, what the progress has been, so I would refer you to Tuesdays if you want to see details. Testing looks good, doing about 13,000 a day. And in that setting, our positivity is 3.4%. Very pleased with that. We've been under 5% this whole small surge. I also wanted to show you one other thing on the dashboard, because a lot of people are writing in wanting to know what is happening with child cases and especially child hospitalization. So let me show you how to do this so you know how to look for this yourself. When you want to see more detail about cases in Chicago, you want to click here. You want to go to cases. And at first glance, this looks like a lot of what you were seeing on the first page. This is our cases over time. This is how many there were every single day. This is the average. But over here is where you can get some more details. See how you can sort by age or gender or race ethnicity? So if we go age, it divides all of our data for all of COVID by age group. This would be for cases, and then you slide this slider to get a sense. So if I want to see what's happening, let's see, in the last month, for example, let's go to like 8/15, between 8/15 and 9/15, and I slide that, see how it changes all these graphs and it changes these numbers, and it lets me know what is the current daily average and what is the case rate. So by age here, cases, and if we play this out, you can blow it up this way if you want to get a little bit of a closer look. What you can see is that the red here are 18 to 29-year-olds. We're averaging about 19.8 cases per 100,000 18 to 29 Chicagoans every day. Next, most likely to be diagnosed with COVID at this point in Chicago are 30 to 39-year-olds in the light blue, and then next are the kids, 0 to 17-year-olds. And you can see that that's been true really this whole time. We've just seen in the dark yellow here people in their 40s fall a little bit underneath the child rates, but these not seeing anything hugely out of the ordinary. I do expect to see some more increases probably in child rates. We just know that the younger kids have not had the opportunity to get vaccinated. We know that's the most important thing to help prevent COVID. And as testing continues to ramp up in schools across the whole city, all of our schools, we probably will be seeing some more child diagnoses. But bottom line, nothing's unusual or concerning here at this point. And then also, if you want to go back and get a sense of hospitalizations, you just do the same thing. Click here. I want to see what's happening with hospitalizations. And if we blow that up, you see how different that looks. The dark blue always is our 0 to 17-year-olds. See this on the bottom? Absolutely flat. We continue to average, it's 0.2 per 100,000 per day. Bottom line, we are averaging 1 Chicago resident under the age of 18 being hospitalized with COVID every day. And it has actually been that way for months now. And so there are a lot of Chicago children who get hospitalized every day in Chicago, but not for COVID. And so obviously we keep an eye on this, but this is very, very reassuring. Whereas what you see, what you would expect, the gray here, 80 plus, see how this is by far the highest rate? People in their 80s are by far the most likely to be hospitalized with COVID, and then really it's all about age and vaccination status. So this is how you can look at this graphically. You can do the same thing for deaths. I mean, we average 0 deaths daily for children in Chicago. And then this is it by numbers. So this is our current daily average in the middle here. You can either do cumulative totals here, or so you can see, in the last month, August 15 to September 15, for example, we've had 2,642 cases in children diagnosed in Chicago. We've had 27 children hospitalized, and there has been 1 death over that month. And then we are averaging at this point 94 cases a day for children, 1 hospitalization a day for children, and 0 deaths per day for children. And then you can see how that compares all the way down. So this is how you can take a look if you want to see what has been happening. But bottom line is that we are doing fine compared to a lot of places, and that is because we are pretty vaccinated, not vaccinated enough, but remember all of our zip codes at this point, we're still trying to figure out a little bit that very far southeast one that shares with Cook County, and some people got vaccinated in Indiana. But besides that one, all the rest of our zip codes now, the majority of eligible Chicagoans, over 50%, have gotten at least that first dose. 50% is not good enough, but it's an important benchmark. And we've hit important benchmarks for kids where more than 60% of our 12 to 17-year-olds across the city have gotten at least their first dose, and the majority now, more than half, are fully vaccinated. So that continues to be the group we're making the most progress in. It's where we're really working with Chicago Public Schools, but all of the other schools too, wanting to make vaccines available, wanting to help parents who are busy but willing to get their parents vaccinated. What can that look like? And so that continues to be a group we're making good progress in. So I dove in a little bit there, and I hope that helps some of you who are wondering, what is the data, what is the numbers? You can do the same thing for gender, race, ethnicity, cases, hospitalizations, and deaths. You use this slider to look at any time period, and you go back and forth here for cumulative totals and daily averages over the whole pandemic. And if you've got more questions about the dashboard, I always like answering questions about data. So let's go ahead and turn to some of your questions. We can come off the dashboard page. All right. Oh, thank you to everybody wishing me happy birthday. That's lovely. I appreciate it. Okay. So lots of things here. Brittany Lynn, let's start with on Facebook here, says, I know it's a good thing, but do we have an understanding as to why Chicago is doing so well versus other regions? Do we expect this trend to hold during the fall and winter? All right, Brittany. So good question. I do not I can't with certainty, completely answer either of those questions, but I can tell you my opinion and what we think based on what we've seen happening around the country. So I do think there's a few reasons why Chicago is doing well compared to other regions. And in terms of the virus itself, I think the most important thing is that we are generally better vaccinated than most of the rest of the state and most of the rest of the region. For some context there, when I looked at it last week, there are 97 counties in Illinois, and Cook County is the third most vaccinated of those 97. Both Lake and DuPage counties had a higher percentage that were vaccinated. And there's different ways to define this: first dose, second dose. If people have been looking at this in detail, there's a very small county that shows up as very highly vaccinated, but there were actually some data issues with CDC. So I would refer you to the IDPH website. But the bottom line is, although we still have a long way to go, there are parts of the state even that are half as vaccinated as the city is. And that is a recipe, as we have seen across the country, for real trouble. And I also think we have put a lot of emphasis, like throughout this whole time, at not just focusing on the average. Yes, I am glad that, we've hit more than 70%, of adults have gotten the first dose, but more than that, from an equity perspective and from a disease control perspective, I care a lot more about getting every one of those zip codes to, 50%, for example, 60%, aiming on this. And so we set city goals, but we focus the most on social networks, areas, groups that are less vaccinated, because those are the places where COVID has the potential to really take off. If you remember, way back at the beginning here, when vaccine was available, here in Chicago, we did our Protect Chicago Plus initiative, and that was recognizing, we looked at a lot of data, said basically, what are the 15 communities that have been hardest hit for COVID, but also have the most risk factors, less access to medical care, fewer primary care, looked at a whole host of things. There's information on our website if you want to see how we did that. And then in those community areas, we really, really doubled down on early vaccine access. So opened up eligibility early, had some younger people be able to get vaccinated. And here in Chicago, we focused a lot on the essential workers. So more than a lot of other places did early on, when it was hard to get vaccine. And I sometimes call it the beanie baby period, where everybody was very, very, very much wanting to get vaccine. And the challenge was more being able to find it. I think the ability we worked really hard here that every one of those essential worker groups, starting with the healthcare workers, but then the teachers and the transit workers and the grocery store workers and the factory workers, we did a lot in terms of bringing vaccine to and through employers. So we got a lot of our most vulnerable in terms of people who are out in public, maybe having some of the higher risk essential jobs, and people who were living in some of the most impacted areas vaccinated relatively early. And I think that in turn has led to some vaccine confidence throughout those communities. But I also think this has been an all hands on deck approach, right? Certainly the folks at the health department and folks in our healthcare system have been working hard, but boy, I've never seen the city of Chicago come together around a health issue like I've seen around COVID. And certainly there are people who, have questions, and, I welcome questions, but I do think in terms of a lot of the work that's been done, whether it's through the department, whether it's through federally qualified health centers, whether it's through hospitals, of, hiring folks from community to do outreach in community, lifting up voices, taking the lead from people in their communities about how to best, get the right information out, get the vaccines out. We certainly have not gotten everything right there, but I feel good about the fact that we are not just focused, we don't just have some very highly vaccinated places and some extremely under-vaccinated places. I'm not happy with 50% of eligible vaccinated. We have a long way to go, but we are keeping the effort in that area, and I think that is important because there's less opportunity for major spread. I also think we have done a pretty good job here of trying to stick with the science around decisions, honestly. Things like the masking. I know there were people unhappy about putting some of those masks on indoors when we got back into high territory, but it does absolutely help prevent the spread of COVID. And, I've shared some data on here about that. And, we were able to sort of flatten that, turn that, what was looking like a serious increase. And we've been hanging out in the sort of 400 to 500 range that whole time. And I really want to thank Chicagoans. I know it was frustrating, especially for people who are fully vaccinated, to feel like, oh, do I really have to put this back on? But doing that has absolutely helped us. And I think, in the school settings where we are fully masked and the adults need to be vaccinated, those are the two most important things in terms of everything we can do to keep schools open and both kids and staff safe in them. I do think, to the second part of your question, sort of what's coming with the fall. For me, there is a lot of uncertainty related to the environment piece. Whenever we think about how any outbreak is behaving, we think about the pathogen, in this case, the virus. So we could get a new variant, right? Like a variant of high consequence, or something like Delta that's so much more contagious. If we get enough change in the virus itself, that can completely throw off predictions and could really alter things. We have the host, in this case, us, humans. What is our behavior like? Are we putting our masks on? Are we getting vaccinated is the most important thing. Are we continuing to wash hands? All of these things. What are our decisions and behaviors, and how much are we distancing? And then we have the environment. And that can be things like the individual level. What have we done to create distance? What have we done in terms of the environment to make it easier for people to do things that would help stop the spread of the virus? But it also literally means the environment in terms of hot weather, cold weather, humidity, etc. And we know that most respiratory pathogens follow a seasonal pattern. You all are familiar with cold and flu season, right? I think there is a decent chance we could be developing into a cold flu COVID sort of season. I don't know that that is going to happen, but I am a little concerned, as we head into cooler weather here, that as we all here in Chicago move more inside, we create more opportunities for spread. In the South, you think about what happens in the summer when it's really hot. Florida, for example, people go inside, but they go inside for air conditioning, right? Whereas up here in Chicago, we go outside in the summer and we tend to go inside in the winter. So nobody knows for sure, but there is some concern that the sort of summer surge that we've seen in the South could be a little bit of a winter surge in the north. And we saw some slight suggestions of that maybe last year, but last year nobody had a vaccine. There was very little, even low levels of natural immunity, so that vaccine showed very little seasonal pattern. So I'm watching really closely, especially as we head into November and December. I'm worried because I expect a flu season that will be bad, certainly worse than last year's, where we had very little flu because everybody was masking and distancing and being very careful and washing their hands. Right now, the children's hospitals, they're not full because of COVID, but they are fairly stretched because they're admitting a lot of young children who have other respiratory viruses. Like RSV is a virus that's very common in young children, but especially in babies, it can be serious, and sometimes kids have to be admitted to the hospital. We sort of skipped an RSV season. We skipped a cold and flu season in some ways last year, and so we're getting a little bit of a double whammy in terms of those other respiratory viruses. And so if we have kind of a bad cold and flu season for kids, for adults, and then we layer any level of COVID on top of it, I have some concern there. But also, last year, granted it was before vaccine, but that sort of October into November, December is when we really saw that big peak. So if we can get into November, December, January here without anything hugely concerning, I think it should be relatively actually smooth sailing from here, unless we get a new variant, unless there's a major change in the virus where vaccines are not being effective. And the more people we get vaccinated in the meantime, the less we sort of see moving forward of these like little up and down surges, which I think are going to be with us for the long term. That was a very long answer, but we spend a lot of time thinking about this, so I hope that was helpful. And some of you who are writing, when is the pandemic going to end? Some of these questions. We are not going to eradicate COVID, just to be super clear about that, unless there's some major breakthrough in terms of drugs or something, or a vaccine that is 100% protective, which I don't expect. But I do think it'll come into either a very high level of control, something like measles. Most people are vaccinated. We see cases of measles in Chicago from time to time, but we don't think about measles on a daily basis. We don't go out and wonder, am I going to get exposed to measles? That's because 94% of Chicago is vaccinated against the measles. On the other side, flu, not really in great control. There are things we can do. We get vaccinated against flu, helps protect against flu, helps protect against spread, especially helps keep people out of the hospital and keeps them from dying from flu, kind of like the COVID vaccine. But it sort of rises and falls as part of a life. And we're a little more on that side in terms of where I think things will be going. Jen, Chicago Mom from Twitter, how are you tracking breakthrough cases? Not breakthrough hospitalizations and deaths, just breakthrough cases. So every single time someone gets a positive test in the city of Chicago, a Chicago resident, by law, it has to be reported to the health department. Every single case that is reported to the health department, we behind the scenes match that person's test record to all of our previous records. We look back and see, did this person have COVID before? Because we do see people, especially with some of the new variants and whatnot, we do sometimes see people who had a prior case of COVID get diagnosed a second time with COVID. It's not that common, but it happens. We're very interested in that because could that be a new variant? Could there be something going on there? And so we keep track of those. But then we also keep track of breakthroughs. Every case that is reported to us, we automatically compare against our vaccination database. And we say, is this person a vaccinated person? If so, you know, did they get one vaccine, two vaccine, which vaccine, how long since their vaccine? And then we report out the rates of those with the graphs on our dashboard. So if you go to that data tab and you go to breakthroughs, you'll see week over week what those rates have been. And so that is how, for example, when we are reporting out what is the risk of cases, deaths, hospitalizations, that's what you can see. So yeah, that's where you're able to see it. And you can go to you know, on chicago.gov on our site, there's a breakthrough page, and we can put a link or you can find it. All right, lots of people I see asking about kids under 12. Let's take Zareta Baraza on Facebook. What about kids 12 and under since they can't get vaccinated? And we've got a number of people asking about, you know, timing of vaccines again. So here's what we know. I do not have a 100% answer for you about when children will be eligible for vaccine, but I can tell you what I do know. One is that Pfizer is the furthest along in terms of completing their studies for children. Pfizer, Moderna, J&J, they're all doing studies for children, and they can't rush these studies. You have to enroll a certain number of children. The FDA actually wanted a slightly expanded version. They've been looking at different dosing. They've been looking at immune response. They've been looking to see how many kids develop COVID, et cetera, et cetera. They had a great people were really wonderful about volunteering for these studies. They did not have any trouble enrolling kids for the vaccine studies. My sister, who is a pediatrician, I had her on once, tried to enroll her kids in the study and they didn't get chosen. But you know, the good thing was it was very easy to recruit for these studies. But nevertheless, you have to follow these kids for a certain amount of time. We're looking for any safety concerns, and we're looking to make sure the vaccines are effective. And especially for kids, there is zero chance the FDA will grant an authorization if there are any concerns that these vaccines are not both safe and effective at the population level. So we expect Pfizer to be finished with its data collection in the next few weeks, most likely end of September, early October, give or take. You will see, it will be big news when Pfizer is able to submit its data, its application to the FDA. Let's remind how that works then. The FDA has to look at it in a lot of detail. They, again, you know, this is the same process that we use for granting authorization for other vaccines. And I think especially for kids, and just with how many questions people have had about COVID vaccines, they're being extra careful. And so it'll take a few weeks. That's fast. In normal times, right, it can take months. But we recognize the need here. And so we're hearing the FDA is going to do what it can to try to get that data evaluated in 3 to 4 weeks. It's thousands and thousands and thousands of pages of data if you're just like, why does that take so long? And then the CDC is also looking at it. And so the FDA first has to decide, will it grant emergency use authorization for children? And then if they do, it'll be like, what dose is that, right? What timing, et cetera. And then the CDC, they basically say, yes, this can move ahead. And then it's actually the CDC, and specifically what's called the Advisory Committee on Immunization Practices, the ACIP, which they're independent. So it's this independent advisory group that looks at all the data. I know some of the people who look at this data, et cetera. And they actually make the recommendations about who it should be given to and kind of when and some of the details. And so I expect, if I were betting on this, that we may see Pfizer vaccines for 5 to 11-year-olds available for kids starting early November, possibly late October. That's not a definite. If there's delays in the trial data, if there's any concerns when the FDA or the CDC are looking at this, or if they decided not to grant an emergency use authorization and wanted to wait for the full approval, that could push it to sort of early January. But my expectation is that we are probably 6 to 8 weeks away from there being vaccine available for 5 to 11-year-olds. I think 2 to 5-year-olds are coming, 2 to 4-year-olds are coming not very long after that. So I think probably around the turn of the year, kind of January-ish, we may be thinking about the 2 to 4-year-olds, and then the 6 months to 2-year-olds probably a little bit behind that, but we'll see. And then Moderna, J&J, kind of behind that time frame. So that is my best guess, and we will obviously keep you updated as we learn more. And related to what to do about kids 12 and under, so the most important thing is have the adults around them vaccinated. Adults spread COVID more easily than children do, especially young children. And that's number one. And then number two is have the kids wear the mask. They're unvaccinated, right? This is part of why, we were able to have in-person school successfully here in Chicago, including full classrooms in some of the parochial and private schools, because kids were wearing masks and people were paying attention to the distancing and having to do some of this quarantining and all these things that I know are disruptive. But having vaccines be part of that is even more to the point. So I know it's hard for parents. Please rest assured that the predictor for what happens with kids is what happens in the community. So we have seen time and time again here in Chicago, across the US, around the world, that the biggest driver for what happens with children's infections is not about whether they're in school, it's about what is happening with community spread and the outbreak in the larger community. Because again, COVID takes advantage of opportunities. When it has good opportunities to spread, when we're not thinking about it so much, is when it tends to spread. So we don't see, there are cases, we will see some spread, don't get me wrong, in school settings, in youth settings, but statistically, kids are most likely to get infected with COVID at home. Adults are most likely to get infected with COVID at home. And in other settings, like not so much in the school sitting in the classroom, but like the extracurriculars, the gathering, the times when you're without your masks and you're together, especially if you're indoors, there's a lot of unvaccinated people. So try to be outdoors while our weather is still good here when you're doing, meeting up to play and doing all this, and have the kids wear the masks indoors. And everybody who's unvaccinated, everybody needs to be masked right now indoors, but especially if you're unvaccinated, and that goes doubly for kids, please try to do it. But where people have really young children and they're worried about it, as long as the adults around them are vaccinated, you're being careful, chances are quite good that you will actually be fine. So I hope that helps reassure a little bit. Diane Baskin on Facebook is saying, is it possible for me to weigh in on plexiglas dividers in the classroom for children ineligible for vaccines? So I think plexiglas dividers are one of those interventions that there was a lot of interest around sort of earlier on when there was more being learned about kind of how COVID was spreading, et cetera. I think the bang for the buck there is probably not there. In terms of source control, really the masking is one of the best things that you can do in terms of protecting people. The vaccine, for adults and older children, and then when it's available to young children, is the most important thing. And I think the plexiglass dividers actually can give people a false sense of security. Actually, it's kind of like, we still get these questions, can I just, can't I just wear a shield over my face? Isn't that as good as a mask? It's really not. When you look at the studies, CDC does not recommend that you instead of a mask, you just wear a shield, because the COVID is able to move up and around, and in some cases people even think with the plexiglass dividers, perhaps might you actually interfere with the way air is being appropriately moved throughout the room. So I know that there are a lot of, especially, cashiers, places where very frequently people may be interacting with lots of members of the public and wanting to separate that. I think that makes some sense because of the way it's set up. But in a school type setting where someone is sitting there all day, I don't think I think if anything, it might give people a false sense of security and actually confuse in some ways the risk. If people, have those masks on, the adults are vaccinated, you're doing what you can, to maintain the distance and doing the hand washing and doing all of that. Schools, we have seen time and time again, are generally not where we see major sources of spread and outbreaks. JD Chicago on Twitter, is swimming in an indoor pool safe if kids were in the pool area 1 hour prior to swimming? I'm vaccinated but over 65 and worried about airborne COVID. Good question. Yes, it is absolutely safe for you to swim in that indoor pool if kids were in the pool 1 hour prior. And just to put a finer point on that, the pool itself, right, and I think you know this from your question, but just in case people don't, COVID doesn't hang around in the pool water. So the water is not the worry. And in terms of the air, we have no evidence, this is not like measles. Measles is so contagious, way more contagious than COVID, and it truly is airborne, to a point that where we are doing investigations for measles, if someone was in the room 2 hours prior, we see measles transmission. We just don't see that with COVID, and particularly if you're vaccinated, that would not be a concern for me. So good question, but I'm glad you're getting exercise, and I want you to get that exercise. And I would encourage you to go ahead and swim in that pool without concern, primarily because you are vaccinated. Okay. Alex on email, I plan on going to Mexico for vacation. Do I have to quarantine when I return even though I am vaccinated? Good question. Because you are vaccinated, there is not a requirement for quarantine. Let me say that again. Because you are vaccinated, there is not a requirement for quarantine. That is true right now, at least, and again, we get a new variant, things could change. I never want to say this is forever and ever, but right now, based on everything we know, in your workplace setting, generally in the school-based settings, in the travel settings, question. The big question is, are you vaccinated? So if you are vaccinated and traveling, the city of Chicago, the CDC, nobody says you are required to quarantine. They do recommend that you will have to get a test almost certainly to be able to get back into the US, just so you know. So you'll have to show your vaccination card. You've got to do the test. We recommend that you test again 3 to 5 days after returning from travel, particularly if you've been in high-risk settings. That's mostly for peace of mind, but you don't need to quarantine in the meantime. And do, though, wear that mask. You should be anyway in indoor settings, but be extra careful, in the couple of weeks after you return. I would be extra careful about wearing the mask or being in, close unmasked contact with anybody who might be at severe risk from COVID infection. But no, all things quarantine relate to unvaccinated at this point. Aaron Hoffman on Facebook. The hospitalization numbers include people who were admitted for another reason, e.g. car accident or kidney stone, but were found to be COVID positive while they were there. Yeah, good question. So generally they do. We investigate more if, here's the way this works. So hospitals are reporting to us their COVID patient numbers. We will look, especially, if we're wondering about breakthroughs or we're wondering about deaths, we do a more in-depth investigation of those cases. So for example, deaths. If there is someone who is admitted with COVID, for breakthrough deaths, for example. Say someone is admitted, as you say, after a car accident or something. We wouldn't say that was a death caused by COVID. So I hope that helps, generally do it. But these hospitalization numbers are every single day. Hospitals across Chicago are telling us how many people do they have in their beds sort of with COVID. So if they have COVID and they are in the hospital, it does, they are included in the hospitalization numbers. What do we know about long COVID? I see there's a few questions there. So very quickly, that's a big question, and we are still learning about long COVID, but just for those who may not be aware, you cannot get long COVID from a vaccine, okay? Long COVID is when people get infected with COVID disease and then don't ever quite fully recover or take a very long time to fully recover. And we've seen a whole range of ways that this can present. There are people who are pretty mildly infected. There are people who are, in the ICU with COVID who have all presented with this long COVID. And we see in some cases, people having real problems with fatigue or shortness of breath. I saw somebody in clinic a couple of weeks ago who had COVID about 9 months ago and has just had ongoing shortness of breath since then. Young, healthy guy, he's able to work, but he's like, I just haven't sort of been the same. We see people whose sense of smell and taste can not come back for a really, really long time. So there's a whole host of psychological issues. I want to just call attention. There's a study, and Rush University here in Chicago is part of it. You go to covidinspire.org if you're interested in this, because one of the problems is that if you only look at long COVID after the fact, it can be hard to sort out a little bit of what's going on. And so there's a prospective study that the CDC is funding with these 8 universities around the country. You can see Rush is our one here in Chicago, and you can enroll in the study if you're interested. It's an online study, and basically there's things about it here, but to be able to participate, you got to be 18 or older. You have to have had symptoms of COVID-19, suspected symptoms of COVID-19 within the last 6 weeks, and you have to have had a test for COVID-19 within the last 6 weeks, regardless of test result. And then you need to have access to the internet. And if you fit those criteria, if you had symptoms of COVID in the last 6 weeks and a test, and you're interested in potentially being part of a survey, they'll be contacting you for 18 months. The goal of this is to understand more long-term way. You could read more about it, but there's you can earn up to $100, for your time. But this is an example of a study to help learn a little bit more about long COVID, and maybe sometime next week we could talk a little bit more about long COVID, because I think it's one of the most interesting things actually, and something that we continue to learn about. All right, we are just about at time here. Let me see if there's anything else major here. If we didn't get to it, we will, some of these are online. We also use your questions to update our frequently asked questions online. Just quickly from Stephanie Whitfield Smith on Facebook, how are SARS-CoV-2 home tests reported to the health department? Most of them are not, to be perfectly honest. We ask people who get a COVID home test and it's positive to tell their healthcare provider first, because we want the healthcare provider to know, to make sure that healthcare provider should be reporting it to the health department. But all of those negatives realistically are not being reported. We're not counting, it's a fiction that we've ever counted every COVID test, but we think that it's more important to have that testing available. There are some settings in which they may be reported. There's ways you can do it through an app, for example, but the high level picture is we know there are a lot of home tests not being reported, but the positives are. So just to finish up, I want to say thank you for everybody's good questions today. We gave some longer answers, but some of these crystal ball type questions take a little longer to explain, and we will get to some more of these next week. On Tuesday next week, we'll be on at the regular time, and I'm planning to have Nick Prashand, who is the lead epidemiologist at the health department, on with me, and he's going to be talking actually a little bit how we are taking some of the lessons learned from data here in COVID and actually applying them to other diseases. We're going to show you our Chicago Health Atlas. Go to chicagohealthatlas.org if you want to start exploring. It's something we're kind of building up. He and his team have done some interesting work looking at some of the indirect impacts of COVID. So not just how sick are people getting, but some of the economic, and they're just starting to get some survey results back there. So I think we'll try to talk a little bit about that as well. So kind of a data-focused guest on Tuesday, and then we'll also planning most likely to be on Thursday, try to get through a bunch of questions. So thank you, everyone, and keep sending those questions in. Again, appreciate the birthday wishes, those who are doing it, and hope everyone is having a safe weekend. And talk to anybody you know. If you're worried about your kid, if you're worried about somebody, talk to anybody you know about getting vaccinated, because getting the city vaccinated is truly, honestly, the best way to protect everybody. Thanks so much. See you next week.